Welcome to Senior Moments. I am your host, Vickie Carraher. I'm the Senior Service Coordinator for the City of Kettering, and today we have a big show talking about Medicare. I know we talked a lot about Medicare back in October and November when it was open enrollment season, but what a lot of people don't understand is that there is an additional open enrollment season, January 1st through March 31st, for Medicare Advantage plans. Now, those are the plans that you decide to work with, so you're not really going to use your Medicare. You give Medicare the permission to give them money, and they are going to manage your health care for you. That's called Medicare Advantage. You may recognize names like Anthem Senior Advantage, United Healthcare's, AARP. There are lots of different plans. If you're getting ready to turn 65, you probably have one of those things delivered to your house every single day. A lot of mail goes out during this time from the Advantage plans, and there's a lot of misconceptions about Advantage plans. There's a lot of advertisement out there, and they're promising the world. They're promising you no copays and no premiums, and you get home health care, and you can have transportation and meals. What they're not telling you is you're not going to get all of those. And they may be specific situations in which you can get them. And the plans that have no copays at all are not the same as the plans that have no premium. So unless you happen to be someone who also has Medicaid, that's a totally different situation, and we'll address that also. But right now, I'd like to welcome Tracy Goodpaster from the Medicare Connection. Now, Tracy and I have known each other for a few years now. She is an agent. Now, I am not an agent. I am an educator, and so I'll be able to say some things that she may not be able to say because of Medicare, the way Medicare is structured. So I may kind of break in and give my little OSHIP, the Ohio Department of Insurance Senior Health Insurance Information Program. I may break in with that as well, but Tracy's going to give us a lot of our information. She is in actually Town and Country Shopping Center, and oddly enough, she is right next door to my office, the Kettering Connection. So if people get a little confused, they come to the Kettering Connection for Medicare, but they can also go to the Medicare Connection for those things as well. So we're going to talk a little bit about where we're located and what kind of an individual they may be able to see. So let's get started with that. Tracy, thank you for being here.
Thank you for having me.
Let's just get started with who are the kinds of people that you're seeing in the Medicare Connection store?
So we're seeing a lot of people turning 65 now.
Okay.
A lot of people who are turning 65 in the next 3 or 6 months. Mm-hmm. A lot of people don't know how far in advance they need to start signing up for Medicare, so we can help them with that.
So a lot of people will say to me, I turned 65 in June, but I hear open enrollment isn't till October, November. So kind of clear that up.
So if they're turning 65, they have a special enrollment period. They have a what's called initial enrollment period, where they have the 3 months before the month of their birthday, the month of their birthday, and 3 months after with which to sign up for Medicare.
So what happens if I don't, and I don't get into that 7-month window, and I wait? What might happen to me then?
You could have a penalty, a late enrollment penalty, if you don't have a Medicare Part B and a drug plan, or you just don't have insurance.
Yeah.
You can stay on your work insurance if you're still working.
So let's talk about work insurance. So I won't get to retire until I'm 67 and a half. Not sure why that is, but I can't retire till I'm 67 and a half. So I may want to continue working because I can't get my full Social Security at that time, and I have a job in which they offer insurance, and it's really good insurance. So I want to stay on my insurance. At 65, do I have to go on Medicare?
No. A lot of people are confused about that part. So you don't have to apply for Medicare then, but we like to compare Medicare plans to your work plan just to make sure you are on the right plan.
That's a really good idea. I've had somebody come into my office. She had a $7,000 deductible. And so she said, I may spend $1,000 each year. That's really a lot of money to be paying, because she was paying like $300 or $400 a month and still had that huge deductible. So there may be an option of going on Medicare even while you're still working.
Correct. So if you're 65 and a half, 66, whatever, still working, you can choose when to leave your group plan. And it's voluntary disenrollment. You disenroll from your work plan and you join Medicare.
And you can still work.
You can still continue to work.
You just don't have to get benefits.
Yeah, you don't have to pay for the benefits. One thing to look out for, though, is if your spouse is covered under your work plan, you want to make sure they're covered.
That's a good idea. I have spouses that come into my office and they'll say, I can retire, I can get in Medicare, but my spouse can't because she's not 65 yet.
Right, we get that all the time.
And so what would maybe that be something they might do?
So they either continue working and keep their work plan, which is an option. They can switch to Medicare and their spouse can join a ACA plan, a Medicare or healthcare.gov plan. There are also short-term plans that are available. It depends on how long the spouse has before they can join Medicare.
Now, I know there's something with COBRA. So a lot of people, when they leave their employer, they may have COBRA insurance. And what you need to know is that COBRA insurance is not credible. So in order for Medicare to allow you to go past your 65 year, you have to be working and or be on some other insurance that's comparable. But if the insurance that you are on is COBRA, then you still have to meet that 65 year time, because COBRA is not considered to be credible coverage. And that includes your Medicare Part B, as in boy, and your Medicare Part D, as in dog. So that can be really confusing for most people.
And it could get expensive too. COBRA is expensive, number one.
Yeah.
And then you could have a late enrollment penalty if you don't have a credible drug coverage.
So there are lots of intricacies just about getting into the system.
Absolutely.
And people, so let's say I can't sign up for the system. I can't sign up until August. Met with a gentleman yesterday. He can't sign up till June. So you couldn't have signed him up for something, but can he come in and you just talk to him to help him understand when and where and how?
Yeah, that's what we really like to do, is get him as early as we can so we can explain, 3 months out you need to do this, 4 months out you need to think about this. The earlier we can get them. Lately we have been getting a few who are really running late and starting their Medicare, and they want it, don't come in the week before you want to start it the following month,
I will have people call my office and they'll say, it'll be the last day of open enrollment, and somebody will say, you need to see me. And I'm like, that's not always a possibility. But you have several agents in your office, where I'm a one-man show at the Kettering Connection. You have how many agents in your office?
In the Kettering office, we rotate about 7 agents out of there.
So just in case you're not a Kettering resident and you're seeing this, let's say you're up north of Dayton, are there other Medicare Connection sites that people can go to?
We have one in Mason.
Okay.
It's just south of Kings Island. And we've got about 7 or 8 agents rotating out of that one too. But we do house visits too.
Oh, that's awesome.
Of course, during COVID, we'll have a mask and everything, and be respectful of distance and everything. But
that's really nice for individuals who can't get out of the home.
Yeah.
Now, there's another group of individuals who are eligible for Medicare before 65, and that's individuals who are disabled.
Right.
So tell me a little bit about how do I go about getting disability Medicare?
So when you apply for disability Medicare, you can get Medicare 2 years after you're approved for disability. They will backdate it sometimes. That's up to whatever your disability date was. But you only qualify for a Medicare Advantage plan or a drug plan, Part D, in that situation.
So if, let's say I got into a Medicare Advantage plan when I was disabled, but now I'm turning 65. Because I'm 65, even though I've had Medicare for maybe 5-6 years.
20 years.
Now that I turned 65, am I eligible for other things?
Yes, you're eligible for a Medicare supplement plan. In Ohio, you have to be 65 years or older to get a supplement plan. Those are called the Medigap plans. And you have a special election period to get a plan because you're turning 65.
And it's really interesting. People ask me, what's the difference between a supplement and a Medigap? Well, if you know anything about original Medicare, there are gaps. Sometimes gaps so big you could drive a truck through them. So Medicare supplements are also called Medigaps. So when we use that term, we sometimes use it interchangeably.
Right.
So tell me a little bit about, how do I go about choosing an Advantage plan if I really think that's what I want to do?
Well, you can come in. The first thing we do is look up your medications, look up your doctors, because Advantage plans do use a network of doctors. Most Advantage plans do. There's HMOs and PPOs. The HMOs do use a network of doctors. There are exceptions, but we want to make sure that you can keep the doctors that you want, that you have now.
So I need to not only think about what kind of coverage I want, but I need to think about whether my doctor will take that. And why do I need to know about my medications with that?
There's a different formulary for every carrier. And even within the carrier, different plans have different formularies.
So tell me what a formulary is.
Formulary is a list of medications covered by that plan, by that company.
So let's say I take a lot of medicine. And so do I need to look at every medicine I take?
Every single one.
So if I take a medicine and I sign up for a Medicare Advantage plan, and then I find out that Medicare Advantage plan isn't going to cover my medication. So it's kind of important to make sure that does.
That's why you want to do it beforehand.
Yeah.
Because you only have a couple chances to change plans, like you said before.
And so if I've made that mistake, do I get the chance to go back and say, I want a different plan now?
Right now you do, but not necessarily.
As long as you're during open enrollment period.
Correct. Until the end of March, you can.
So let's say I join today in February, I join an Advantage plan. When might I start that Advantage plan?
The first day of the following month, so
Okay.
March 1st.
So if I join in March, it would be April 1st.
Right. Even if it's February 28th or 29th on a leap year, you start March 1st.
Okay. And so I may not get a card. So what would I do in that situation?
So we do have numbers from the insurance company as far as usually within about 3 or 4 days, we'll have a member ID number for you.
Okay.
If you need to go to the doctor, and then there's certain prescription numbers, the bin number and the group number and everything to take to a pharmacy.
So what happens if my doctor decides I join in February and my doctor in June says, I just don't want to do business with this company anymore? Can I switch then?
No, and we don't see that very often, but we actually do have a situation this year where a whole medical group is not taking one of the carriers. So people are changing right now.
Yeah. And I think that's one of the things. We had some eye doctors back during open enrollment who were at a very large practice.
Yep.
And they decided they were no longer going to take one particular insurance. And so individuals were, we talked to the eye doctor's office and they said, we're pretty sure we're going to have a contract, but we can't say so. So Medicare open enrollment ended December 7th, and then they came to a conclusion later. So if you are someone who switched Medicare Advantage plans during open enrollment because of a situation where your doctor changed things and now that's resolved, or if you started and then your doctor switched. Even if you switched back in the fall enrollment period, during the Advantage open enrollment period, you can switch again.
You have one time where you can switch.
So let me ask you this. So let's say I want to switch drug plans during this period. Can I do that?
No. The drug plan enrollment period ended December 7th.
So let's say I am really having problems paying for my medications. Are there some things that we can do to help you with that situation?
Yes, and that's something we like to do in our office too, is help people sign up for what's called extra help with prescriptions. And your income limit has to be at a certain level. So it's about 10 minutes for us to fill out the application for you. We do it all online. And you get notified within 2 weeks, usually 2 weeks, depending on how busy they are right now.
So tell me this, under this program, the extra help program, are there different levels that I can get? How does that happen?
Yeah, so it's all dependent on your income and how many dependents you might have living at your house. So if your income's a little higher and you have some dependents depending on you for their care. But yes, it depends on what your medication's going to cost. Depends on which level of Medicare or extra help you get.
So let's say I'm a grandparent and I've looked before and I was right on the cusp, and now I have been given custody of my grandchildren. Are my grandchildren, they're not my children, but if I have custody of my grandchildren, are they dependents?
Yes, yes. And that's exactly what's happening right now in the country, is we do have a lot of those situations. And yeah, it really lowers the cost of your medications, especially if you have the highest price medication. I believe it's $9.50 for this year. Your medication won't cost over $9.50. Some of them are $0.
Yeah. That's a good thing to know. Now, outside of the Medicare system, let's say you're on a really, really expensive drug. Are there some other things that work with Medicare that might help?
So there are grants also that you can get. There are programs through doctors' offices where they can help you do a coupon program or through a grant program. But there's also instances where sometimes GoodRx or some other little coupon kind of thing works better than actually the Medicare cost of the drug.
Yeah, I had a client who was on a very common blood pressure pill, lisinopril. If you're on a blood pressure pill, probably you've got that one. And he was actually getting it for $2 on GoodRx, but his insurance company was charging him $10.
Right.
So, can you do that? Can you say, I don't want to use my Medicare drug plan, I want to use GoodRx right now?
And that's the thing, you can't use them together. So you either use one or the other. But you can absolutely use GoodRx as long as you want to. If that's a less expensive price. There's a lot of those programs out there, though. Express is great. Yeah, there's a bunch of them out there.
There are a lot. And if you, I'm going to give my contact information at the end and Tracy's contact information. I can assist you in getting those programs, and I actually have GoodRx cards in my office. I can mail it, bring it to you, whatever you need us to do. So with Medicare now, we're hearing a lot. Now, you may have heard on TV, there is an ex-football player, not mentioning names, who is out there advertising, oh, I have this plan and I get this and this and this and this. And I may not even have to pay my my Part B premium, which that is something that you do pay when you have an Advantage plan. You still have to pay the Part B premium, even though you're not really using it in the way that other people do. So tell me a little bit about those extra things that are added on. What is the way that you can make sure that you're not expecting something that's not going to be offered? tell me a little bit about how to kind of temper our yay.
Yeah. So don't believe everything you see on these commercials.
Yeah.
They're very misleading. We get people in all the time that say, you know, I want that money back, you know, and it's like you don't qualify for that.
I'm glad you said that, because some people can get that Medicare Part B premium reimbursed or sent back to them, or not even taken out of their Social Security check. Tell me a little bit about who those people are and what the requirement is.
Well, it's based on your income. So it's people with Medicaid or partial Medicaid. They would qualify for not having to pay the full amount.
So what if I'm not sure?
Always apply.
Always apply.
Even for extra help, even if you're close to the limit, always apply. You never know. It's
free. And I have people that, an odd thing about Medicaid is Medicaid has a $20 disregard. So sometimes people will look and I'll have people say, oh, where I'm $4 over the amount. Well, with that $20 disregard that they take out of your income, you qualify. And so people don't know that they qualify. I always tell people it never hurts you to call either Tracy, call me. Number one, let's get your number out there, and then we'll give it again at the end. But go ahead and give it right now.
So the office number is 937-823-6093.
And of course, you can reach me through the City of Kettering at 937-296-3356. That is my direct line. You can go to the Kettering website at ketteringoh.org. Click on Senior Services, and all my contact information is there, including email information. So just want to get that out. We'll do it again. So if you didn't catch it this time, you may want to get a piece of paper, and we'll be giving it again here at the end. But I did want to talk about people who have problems with dealing with information on the phone. We were talking before the show, we were just chatting about how sometimes we have people who call us and they just can't hear. Are there some situations that you can help in that?
Well, we can do a house visit. They can come into the office. We have shields and masks and everything in the office too. But yeah, it is hard sometimes to understand on the phone, especially when they're giving us their list of medications and stuff. It's usually a lot easier if they email that to us, and we do a lot through email. Okay. And we can, pretty much do it. So they can get you by calling you and emailing you? Yes. Good to know. So if I am someone who is I'm just not sure, but I have people tell me all the time, I don't want to bother you. And I hate that. I hate when people say that, because sometimes they're not bothering me no more. I get paid. So it's job security when you contact me. But the other thing is, a lot of times people just don't know about services, about supports that are out there. They may misunderstand. Those commercials are very confusing. My husband is not in Medicare yet, but we were watching, and the commercial was on, and I just kind of rolled my eyes, and he goes, "What's that about?" And I'm like, what he just said is not the complete truth. It's parts of the truth for different people, all shoved into one commercial, but it's not the whole truth for any one of those people. And so it is frustrating. So just let people know it's okay to call us. Absolutely. It's okay. That's why we're here. And, we enjoy the company all year round, and, we go over benefits when we sign somebody up, but you don't remember those things, 10 minutes later, 10 days later, or 10 months later, so it's always, please call us, come in, see us. We don't mind. But yeah, the commercials, like you said, they take the best one thing out of every Advantage plan there is and kind of make a Frankenstein plan. And and you can't get that Frankenstein that plan does not exist. Yeah, exactly. But each plan does have their own set of benefits, and that's what we like to compare. What are you more concerned about? Do you need dental, or do you need something else more important to you? So people say to me all the time, I am so healthy,
I go to the doctor once a year. I don't take any medicine, and I don't want to pay for Medicare. Or I don't want to pay for a supplement because I may have to pay $100 every month and I never use it. So there is advantage for those people.
There is. And that's pretty much the biggest difference is when I explain the difference between the two plans, I try to say that the supplement plan is the pay upfront way to think about it. You're paying for the insurance whether you go to the doctor ever in the year. The Advantage plan has copays for everything, whether the copay is zero or not, but it has a copay for every single thing you do. And most of those, some of those are very low cost or zero.
Yeah, I said to a lady that contacted me, it was the reverse. She said, I'm really sick. I go to 5 or 6 doctors a month, and I take a ton of medicine, and I've had 4 surgeries this year, and I've been in the nursing home twice. Those individuals may kind of get nickeled and dimed to death with the Advantage plan.
Absolutely. And depending on what their age is, a supplement plan may be a better plan for them.
So let's ask this, though. So let's say I get an Advantage plan, and this year the worst thing happens to me. I have a stroke, and you have all these copays. Is there anything within the Advantage plans that prevent me from losing the house, so to speak, with all the high bills?
Yes. It's called the out-of-pocket max. And it's so confusing sometimes for somebody to understand what that means. And they range anywhere from $3,000 something up to $6,700. And it's not a deductible. That's the biggest misconception. I get people calling all the time that say, I don't have $4,200 to pay before I go to the doctor. Well, you don't have to pay that. That's your max out of pocket. So it includes anything healthcare related, not your medications, but any healthcare in-network related fee counts towards that max out of pocket.
It's not your total cost, it's what you've paid out of pocket.
Right. And it's the maximum you will have to pay in a calendar year before your plan pays 100% of everything else.
I have had people who have had cancer and chemotherapy and radiation, and they never actually meet that. So some of the Advantage plans have some really good benefits. If you have questions about whether your plan covers the extras that you're hearing about, you can contact Tracy. She'll be happy to tell you each individual plan, what you can and can't get extra. A lot of people don't know that some of those plans offer an over-the-counter medicine benefit, which is nice. My mother is in an Advantage plan. She has an over-the-counter benefit, and her over-the-counter benefit is so high that last year she couldn't use it all. She goes, I don't need any more Tylenol. I have all the vitamins I can use. So, but you can get canes, walkers, adult diapers. There are lots of things you can get with that you can't get with the other types of Medicare. So you definitely want to make sure. If you're not able to call Tracy or myself, on the back of every card is a member service number. Call your member services, say you've heard a lot about the program and you want to know if you're eligible. We need to one more time, we're kind of running out of time, but go ahead and give us your contact information again.
So the office is 937-823-6093. We're right in Town and Country, right next to Vickie's office. So we're on the east end of the shopping center. Our website is the Medicare Connection at themedicareconnection.com.
All right. My name is Vickie Carraher. Again, my number is 937-296-3356. Thank you definitely, Tracy, for being here. If you have questions, give myself a call.
Thank you.
Also, we'll be talking about the COVID vaccine next month on Senior Moments. Thanks for joining us.